Physiological aids. Physiological aids are used by athletes across the world to enhance their performance in different sports. According to Bartleby.com, physiological aids are banned substances and methods which athletes use to improve performance in competition and also in their training. Types of aids that athletes use vary depending on the sport they do. For example, a jockey may use diuretics as this causes you to lose weight quickly. This would be an advantage to them because it means that the horse has to carry less weight, therefore it can increase its speed without working so hard. Other aids work to increase heart rate, increase adrenaline rate, which overall stimulates the body. However, other athletes may use physiological aids to change the growth of muscles and bones quickly over a short space of time, and also types of aids may be consumed or injected to lower their heart rate. For example, a darts player may use this so they can take an accurate shot. One common type of physiological aid which is used is the human growth hormone. The human growth hormone is already present in the body but in lower levels than what may be injected or consumed. According to Briticon.com, the human growth hormone, also known as the somatotropin, is a peptide hormone that is secreted from the anterior lobe of the pituitary gland. Its role is to stimulate the growth of all tissues in the body, such as our muscles, tendons, and ligaments. It also has a role to stimulate the growth of our bones and cells. The hormone is normally produced at around 1 to 2 milligrams per day, leaving the pituitary cells called somatotrophs, and it enters the body. The amount that is in the body of a child is typically a lot higher than that of an adult because it peaks at the age of puberty. The growth hormone stimulates the process of protein synthesis and it increases how quickly the body breaks down fats. This then creates excess space within certain areas of the body where muscle can develop. Although the human growth hormone occurs naturally in the body, some athletes inject themselves or consume it in tablet form to aid their muscle growth and development. The hormone is available in different online stores at an affordable price starting from around £18. If athletes buy this drug and use it, it is known as an illegal ergogenic aid. One positive effect from taking the human growth hormone is that it stimulates bone, cartilage and muscle growth. Having strong bones and cartilage is important for athletes such as a heptathlete because of their events being very high impact. Events such as the long jump puts lots of pressure on the bones in the legs of the athlete because when they land this is where all the impact travels to. The role of cartilage is to cushion bones where they form a joint to stop them rubbing together or wearing away the bone. However, over time of constant impact the cartilage can be broken off or worn away if it is absorbing high impacts. Therefore, by the heptathlete taking extra of the human growth hormone, it means that their cartilage will be regenerated faster, which is an advantage to them and their sport because their bones will be under less strain and impact, reducing the risk of breaks and fractures, which would put them out of competing for a long time. Another advantage of taking the human growth hormone is that you experience an increase of muscle size. The heptathlon is a variety of events which require agile and fast athletes, as well as strong and endurance-capable athletes. Athletes require strength in events such as the javelin and shot put, however they require speed and agility in the high jump, hurdles and 200 metres, but they also rely on endurance for the 800 metres. Having bigger and also stronger muscles in events such as the javelin is a benefit to the athlete because it means they are able to generate a bigger force. As muscle size increases, it means that the force the muscle can generate also increases due to bigger muscle contraction taking place. In short bursts of exercise such as the javelin, the athlete relies on their anaerobic abilities to perform. This means they are using their fast twitch muscle fibers and they are working without oxygen. If the size of the muscle is increasing due to the growth hormone, it means that the muscle is more likely to create extra fibers in the muscle which the athlete can train to use more efficiently in their event. This means that more fast twitch muscle fibers will be available, allowing faster muscle contractions to fire. This then allows the athlete to generate larger force as the muscle contracts, allowing them to throw the javelin further, and they are able to increase their overall score. Although these factors prove to be an advantage for athletes who need quick recovery and a high volume of muscle mass, the human growth hormone also comes with consequences. The use of this ergogenic aid is actually illegal, means that if you do use it, you're at high risk of being found out, and this can lead to disqualifications across the board of sport. It is on the prohibited list of the World Anti-Doping Agency, which means that all athletes are monitored before taking part in games such as the Olympics. This is to ensure that the games are safe and fair for all. However, someone can take the human growth hormone and it will not show up in the test after 1 day of not consuming it anymore, making it an easy drug to try and use around eventing. Consuming extra of the growth hormone can come with some serious side effects. One of these is that it can damage the growth plates in the femur. These are important because they reduce the impact of the bone. However, if the plates become damaged, it means that they won't be able to perform their role efficiently, causing greater risk of an athlete suffering from a fracture of the bone and making them unable to compete. According to Wadder, another side effect that athletes may suffer from is the worsening or increased risk to cardiovascular diseases. This is linked to the fact that the hormone increases blood pressure. It's a negative side effect for athletes because a high blood pressure means more force from the blood is being placed on blood vessel walls. This in turn puts more strain on the heart because it is having to work harder to pump blood through the tight and narrow vessels. This is especially concerning for an athlete because their heart has to work harder during exercise to supply the muscles with enough oxygen. If the blood vessels are under more pressure, it can lead to even more force being put on the heart, which can lead to serious health conditions such as heart attacks and strokes, where the heart is put under so much pressure that the walls of the vessels cannot cope, therefore causing blockages and also ruptures.